Good morning. You're welcome to the show. And of course, I have with me this morning Mrs. Roseline Ibe. She's here with us this morning. She's going to be discussing, we're going to be talking about stroke. Like we know, stroke is a life threatening, ailment that, if not, promptly taken care of, could lead to, somebody losing their lives. I have with me this morning Mrs. Ibe Roseline. She's a consultant physiotherapist of Rose Meg Physiotherapy Clinic. Good morning, ma'am.
Good morning. Thank you.
How are you today, ma'am?
I'm fine. And you?
I'm very well, thank you.
Thank you.
Yes, ma'am. We know that, like I said earlier, that stroke is a life-threatening, ailment that, if not well taken care of, could either, turn the person into another thing they don't wish to be, and of course, they might lose their life on the process. Now, first of all, as a physiotherapist, who actually your job is, making sure these people recover fully and they're able to use their hands, their leg, their brains again. But let's what is stroke, and what are the stages of stroke? What actually causes stroke?
Okay. Stroke has a medical term known as cerebrovascular accident. Cerebrovascular in the sense that it has to do with the brain. When the blood supply to the brain cells is stopped by whichever reason, either by blockage of the blood supply, or there is bleeding in the within the brain. So when the brain is not getting enough supply of blood and oxygen, the brain cells die off. So when the brain cells dies off, the part of the brain that controls the body movements, because I'm going to use terms that a layman will understand.
Okay, good.
Yeah. So the way we move, the way the part of our body, the movement is being controlled by the motor aspects of the brain. So when there is problem with blood supply to the brain cells, they die off, thereby affecting the part of that body where the brain cells, those brain cells are controlled. So the parts of that body, especially one side of the body, both the arm, both the leg and the face, most of the times, they get paralyzed because they are no longer getting life from the brain. So the control is lost. So what you have is paralysis of that side of the body, called stroke. So most of the times, people have misconception about this brain disease. Some will tell you it's the demon-inflicted disease, and most of them, they don't take the right precautions and the right move towards the person's recovery. So when stroke happens, what do? You rush the person to the hospital immediately. The first thing is to, in the area where it is blockage of the artery, hindering blood to flow, the doctors make sure that they restore blood flow back to the brain cells. That is the medical attention. So whichever way, whichever means, all the procedures at that time is to restore blood circulation back to that aspect of the brain. And we have two major types of, stroke. We have ischemic stroke. Ischemic is caused by a blockade. There is an artery around the neck region called carotid artery that carries blood to the brain. So when there is a blockade, what happens? The blood and oxygen will not reach to the brain cells. So we call it ischemic. At that stage, the medical attention is to make sure that blood gets back to the brain cells. There is continuation of blood supply. Then, if it's hemorrhagic stroke, in the issue of hemorrhagic stroke, the artery or the blood vessels carrying this blood to the brain burst and there is bleeding. So when there is bleeding, there is a problem. Most of the times, this bleeding, happens in such a way that the blood will not get to the blood cells, to the brain cells, thereby causing the brain cells to die off. And what causes the hemorrhagic or the ischemic? In ischemic stroke, most of the times there is cholesterol, hypercholesterol. When the cholesterol level in the system is above normal, they can form clots within the blood vessels. And this can trigger off to cause a blockade towards the artery that takes the blood to the brain.
The brain. Okay.
Yes. So in hemorrhagic stroke, you have high blood pressure. The high blood pressure, when the blood pressure is not controlled, it could burst. When it bursts, there is bleeding. So a lot of things lead to this either blockade or bleeding. So these are the two main causes of stroke.
Stroke and the types as well. Now, but what is the hardest stroke to recover from? For all you've said so far, the types, which one is the hardest one for a patient to recover from?
Fine. The recovering of a stroke patient depends on the extent of damage.
Okay.
So most of it, I say recovering of a stroke patient depends on extent of damage done to the brain cells.
Okay.
And there is motor units, there is what we call upper motor neuron of the brain, lower motor neuron. So when there is the upper motor neurons are affected, spasticity sets in. Spasticity is a kind of stiffness that comes from the brain, not just that the patient is causing it. So at that point, there is too much firing. And that one, to recover, is a bit more complicated than when it's flaccid, when it happens at the level of lower motor neuron. In that case, there is weakness, there is flaccidity. That kind of stroke recovers easily than when the spasticity has set in. And another thing is that recovering, the hardest stroke to recover, hemorrhagic stroke, it looks more difficult recovering than the other one, which is ischemic. So the way you manage for a patient to recover depends also how you manage it.
Manage the patient.
Yes, because most of the times patient relatives influence their management. Because some of them will come and say, no, it's not treated in the hospital. I have so many relatives we have lost because they have superstition.
Yes, I was going to come to that, doctor. We know that in the part of Africa where we are from, especially in Nigeria, people tell you, a stroke is something that you don't need orthodox medicine, something you need, strong, herbal medicine, tradition roots and all that, to, maybe tie the leg, massage, give them herbs for the thing to go away.
Yeah, most of the times it doesn't work that way because in rehabilitation of stroke patients, you are feeling the part of the brain has lost control, existence of that particular part of the body. So the brain has lost control. That particular part of the body is no longer existing as far as the brain is concerned. So what do we do in rehabilitation? We use feedback mechanism through the language that the brain understands, which is the language of movement. And we use it to send feedback information back to the brain, telling the brain that this part of the body is still existing. And in that case, it is what the physiotherapist program back to the brain that the brain will give you back during recovering. Even when the physiotherapist is using exercises and the language of movement to send back information concerning that part of the body, you have to be very careful as a physiotherapist, because if you don't know the right thing to program, you will still program information that is not correct. And when the patient is recovering, the patient could recover with abnormality or wrong pattern of movement because you have programmed the wrong pattern of movement. So it depends on who is handling you as a physiotherapist, and also influence from relatives at that moment. And another thing that makes recovering very difficult is memory loss.
Okay.
When stroke happens and the patient is devastated to the extent that the memory has been impaired. When you are rehabilitating this patient, you want the patient to, resist your movements as a physiotherapist. You want the patient to do this or that. The patient at that moment has lost the memory and cannot contribute to that treatment. So for you as a physiotherapist trying to rehabilitate this patient, you find it difficult. It takes a longer time because the patient is not cooperating with you. Another thing that hinders recovering is dieting. If the patient's relatives are not, involving the dietitian, or they don't have the right mode of feeding the patient, they also complicate it, because we are talking about high blood pressure, whereby high blood pressure and has ruptured the vessels to the brain.
Go
Are
ahead.
you?
Yes.
Yes, whereby the high blood pressure has ruptured the arteries, and you are still feeding the patient with things that will also increase that high blood pressure. You discover that you are not doing good for the patient. And secondly, when a stroke, just like what you said, patients influence, relatives influence, and we being Africans, we believe that is a demon-inflicted injury, so it's not treated in the hospital. Thereby, you quickly take the patient away from hospital environment, say, don't give injection. If you give the injection, the patient will die. And you now take the patient away from medical attention, whereby what happens? They start feeding the patient with herbs, start massaging the patient. Massage is not even the physiotherapy aspect of it. Even before physiotherapist steps in, there should be medical attention whereby the root of, the problem is arrested first. You
Okay.
control the blood pressure. If it's a clot, you try to resolve the clot first. But that doesn't mean that in a hospital, the physiotherapist comes in after patient has recovered. No. As soon as the patient is on admission, the physiotherapist is involved, because it could be that the patient is in coma. It could be a complete stroke. It could be partial stroke. So what happens? At that moment, the patient cannot lift the leg, cannot lift the hand. The first treatment line for the physiotherapist is positioning. The
Okay.
physiotherapist comes in as soon as the patient is either in ICU or an admission, whether in coma or not in coma, as long as the patient cannot move the limbs, the physiotherapist moves it passively because, number one, to avoid a clots around the vessels again, because the patient cannot move himself. Secondly, positioning, because you are sending information to the brain. You are telling the brain, look, when I'm standing as a normal person, my palms should be face down. When I'm walking or I'm standing, my leg should be this way or that way. So the physiotherapist knows what to do when a patient is in ICU, when a patient cannot lift the limb. So the treatment starts from positioning. Then after everything is being controlled, because the physiotherapist keeps on with the passive movement until patient is discharged or not discharged, has been stabilized medically. Then the physiotherapist comes in and assess the patient fully and know where to start from. And concerning treatment by physiotherapy, we have laid down pattern of treatment, the way we manage our stroke patients. You have long-term plan, you have short-term plan. What are these short-term plans? You want to get the patient quickly out of the bed. You want to put strength in the leg, put strength in the hand. So we have planned, programmed exercises. It's not a matter of massaging patients, because most of them, they feel, okay, we have this person to do this. Me, personally, I've been in the profession close to 20 years, and there has never been a month I've not seen a stroke patient.
Patients.
And yes, recovering of stroke patients depends how you handle the patient. I've said positioning, the movement of the hand, that's the upper limb. There is a particular movement you program. Okay, when as an individual, if I am standing, is my hand supposed to face up? Is my hand supposed to face backwards? So these are the things we consider in programming.
Okay.
So whatever you garbage in, the brain garbages it out for you. And when it comes to traditional aspect of solution, most of the times they give these patients, you have high blood pressure and they are giving you liquid to drink. What are the contents of those liquids you're drinking? Because most of the times, instead of bringing down your sugar, whatever, your BP is escalating it.
Now, let's talk. You've mentioned quite a lot, but let's look at, you talked about, exercises. Now, what is the core job of a physiotherapist as far, a stroke patient is concerned? What are the
Okay,
things you do to make sure they recover fully?
good. Thank you. As a physiotherapist, when you bring a stroke patient to me to handle, number one, after assessment, I will first of all know the level of strength, the strength in the hand, the strength in the lower limb, which is the leg. Now, what do? I have a strengthening, a mechanism of strengthening the exercise, strengthening the limbs. What I do is that if there is no strength at all, I initiate strength into those limbs by already programmed exercises. If there are some, strengths involved, you can see that, okay, this patient has 2/5 strength or a flicker strength. You pick the strength existing and you strengthen it with strengthening exercises. So in the gym, you have so many things, equipment, exercise facilities you use to strengthen the legs, strengthen the hands. And if there is contractures, or let's say there is spasticity, you can involve splints to break down the spasticity so that the patient can recover. So the exercises we use is not something I can exhaust explaining, because as long as the gym for the physiotherapy gym is concerned, we have all the facilities we use whether it's a TheraBand exercise, um, gym ball exercise, bicycle, and treadmills, and we have all these multi-gym facilities that we can use to strengthen the patients.
Mom, now you did talk about partial stroke and full blown stroke. Can a patient recover from the full blown stroke? I'm not talking about the partial. I know partial a patient can recover, but what of when the person is a total knockout?
Yes, I can give you the assurance that I've managed patients who had full blown stroke and they recovered fully. And we have a lot of them. It depends when they come to you as a physiotherapist. If it's a new, something happened, let's say within some weeks or a month, you come as a patient. It's easier for us to manage. But when after a patient has gone to so many places, they have programmed wrong information to the brain, and the patient comes to us. First of all, it's going to take you time to deprogram the wrong pattern that has been programmed before you start programming the right patterns. So definitely a full-blown stroke patient recovers very well. And another thing is complications, medical complications. If somebody has diabetes and you know that, okay, this diabetes has eaten up this patient, the patient cannot respond well because he or she doesn't have the strength to do what you ask him or her to do. So is a minus. It's going to take long time for recovery. If somebody's BP is not controlled, mismanagement before the patient comes, that's where we have issues.
Now, ma'am, how long does a stroke patient need to stay in your rehab? Depends on how uh, strong it is, right? Partial or
Yes,
full stroke.
yes. If it's a full-blown stroke whereby there is no movement at all, both the hands, both the leg, both the mouth,
Brain and everywhere. Okay, so
yes.
but
Within, you asked me how long.
go ahead.
If such a patient comes to me, I give you assurance within a month, 2 months, the patient starts movement. And within 6 months or less than 6 months, outside strong complications, the patient recovers.
Wow. Okay, something about your video there, you might want to do it very well for the viewers to see your face. But let's look at stroke. When we talk about stroke, we know that you not only deal with the treatment itself, like you said, is a whole lot. The programming, reprogramming, and all that, and of course, dealing with their emotions because they are not even trying to. Maybe most time they don't understand you in the treatment. They don't even want. They are not willing. Carrying them along is a problem. Then dealing with their emotions coming out of the whole trauma as well. So how do you deal with all that, ma'am?
Yes, because every stroke patient is likely to have a swing mood. So the first thing we do is to counsel. That's first thing we do. You counsel the patient and you give the patient assurance. You also try to show the patient those you have managed that have recovered. And also the patients talked with those that are in the recovering process, still coming for treatment. So with all this, the patient believes in you, have faith that you're going to manage him. And because you already know that the patient also can have a swing mood, we are always ready for that swing mood because we have a way of, bringing them to believe in what we are going to do. And another thing is that we counsel patient relatives because a man that is, that has been providing for his family now is down with stroke. You as the family member, we counsel you on also how to handle him so that he doesn't go into mood swing.
Now, doctor, ma'am, what are the signs that when you have a patient, for instance, what are the signs that the person is recovering and there is hope?
Yeah, when a patient has partial stroke, of course, there is some elements of movement telling you that it's partial. So it's a sign that this one is partial, you are going to have a good result. When the patient's memory is intact, the prognosis is beautiful. That means the patient is going to contribute to his recovery.
Okay.
Yes. When other complications are not there, they've been treated, is a plus.
Okay.
Yeah. And when the patient also shows signs that he or she has taken this challenge and he's positive about it, that is coming out of it, is also a good sign.
Okay, ma'am. Now, when when you're done with your treatment and the person has recovered fully or is strong enough to maybe go home, with at that point, do they still need a physio to to continue the treatment or regular checkup, or once they are well, that is it, they are well, they're fine?
Yes, when a patient is discharged, you don't automatically discharge a patient from a stroke patient because there must be a follow-up. The patient has to be coming, assuming this patient has been coming every day, but now it's good to go. You have to reduce the number of times he's coming to the clinic. And if you think this patient has recovered fully, it doesn't need to be coming. What you do is that weekly appointments, because it's a continuous exercise. You don't just say, you have recovered, you go home and stay. The whole muscles, they don't recover once. So there must be continuation, but you limit the how many times the person comes.
Wow. Viewers, this is health. You know that your health will always come first. And of course, today is all about physiotherapy treatment for stroke. Now, we know that in as much as we Africans will believe and we have the opinion that yes, it's herbal treatment. If you give them injection, they will die, they will not walk again. Here is a specialist, here is a consultant, here is a physiotherapist, and she has been there for over 2 decades. And I can tell you for free from what she said that that is just a belief, that is just a number. It is not correct, it is not true. Now we'll go on a quick break. When we return, our health will continue. Stay with us, we'll be right back after the break.
Are you a filmmaker in Abuja and its environ? Do you need a place for your music video, or you need a venue for your conference and even an editing suite for your post-production? Look no further. Our beautiful turret in Lokugoma has it all. We have a whole floor that consists of 3-angle lounge, a beautiful dining area, a large kitchen, a conference area that can comfortably accommodate 60 persons, and 5-bedroom adaptable for all kinds of shoots. The good news is all is available at affordable price. And you know what? If you are a member of the Association of Movie Producers of Nigeria, you have 20% discount. So what are you waiting for? Hurry and contact us on the numbers on your screen now.
Welcome back from that break, viewers. This is our health. Of course, you know that your health will always come first. And like that saying, health is wealth. So we can't help but talk about your health. And I'm still here with Mrs. Roseline Ibe. She is a consultant physiotherapist. Now, ma'am, you did talk about the way they recover, the process at which they recover now. But, can a patient after recovery, there's this norm also, there's this belief that you can't drive, you can't fly, and all that. How correct is this, ma'am?
It's not correct because we have patients who have recovered and they are driving themselves. Even up to now, they drive themselves down to the clinic for exercises. So just like what I told you before, it depends on how patients was managed.
Okay.
And it depends on the complications associated with the stroke.
Okay.
So if a patient is picked up, immediately stroke happens. And medically, both physiotherapists, neurologists, dietitians, counselors, and the patient is well managed, especially the area of physiotherapists, because after medical intervention has taken place, the physiotherapist is left with, a lot of ideas to make sure that the patient did not recover with complications or permanent disabilities. So
Okay.
if I'm able to manage the hand, that's from the point of admission or when the patient comes to me, and I was able to position the hand properly and there is no deformity. So why won't the patient drive after I have put back strength in the hand, the upper limb? So the patient has to drive. I have a lot of them. If you want them to come online and next time and tell you their experiences, I think they will be very much available to do that. So it depends on who manages the patient.
Wow, that would be a good thing. Maybe on our next show, we can bring two or three of them to, testify to this so others as well can, have hope and faith. And that might
Yeah.
just, encourage somebody in that sick bed to want to stay stronger and to fight harder to, stay alive. And then, ma'am, when we talk about, recovering from stroke properly, how positive are we that, or can you affirm to us now that an elderly person, these things you said, the recovering is a process, but somebody that is way elderly, is that even a factor to delay the recovery or not recovering fully when we talk about the elderly?
Yes, when we talk about the elderly, I keep on saying it, an elderly that has renal kidney problem already, or he's diabetic, or he has heart attack or heart failure, he's being managed for heart failure or heart problem. These are complications that also weigh down their recovery. But in that case, what we do, the short-term management we give to stroke patients is to make sure that they can come out of the bed, they can walk to the toilet, they can walk around. They might not necessarily go back to, what they used to do before they had stroke. So we get them to the level of they can perform some actions on their own. So there might not be 100% recovering for a patient who is elderly, but we make sure we get them near normal,
Yeah,
so
normal.
they cannot, yes. And most of them, they already have incontinence.
Okay.
They can't hold their urine. They won't even know when they are urinating. So in that case, you want to get the patients to the level as much as you can, or especially to come out of the bed, sit on the
Wow.
chair, walk around with the walker and all those things.
Well, ma'am, let's talk about, the kind of exercises they can engage in. That is after, discharge, after they are fully at home. What kind of exercise would you recommend for once a stroke patient?
Good. When we are discharging a stroke patient, there are things we'll give to the patient to put in the house, and we also teach them about home program. Like we have what we call pulley. You can install your pulley. There should be bicycle, ergometer that the patient can also use for exercise at home. There is what we call weight, the long weight. Is a kind of something they can strap, maybe 3 kg, 4 kg. They will use it to keep on sustaining the strength of their muscles. So we normally give activities they can perform at home.
All right, ma'am. You did talk about, food and, how patient relative can even help in patient recovering as well. And we know that food is a major factor in all this because what they eat is another issue entirely. Now, what kind of food would you recommend, or do you recommend for once a stroke patient or a stroke patient?
When it comes to dieting, even patient's relative does not have the capacity to involve the dietitian who looks into the medical condition of the patient, because it might not just be that stroke like that, and plan the meal for that patient. So in that case, we also advise them things to avoid, things to eat, like fruits, vegetable, whole wheat, like cereals and all those things. So you will not advise a stroke patient to go and start frying egg and loading himself with things that could increase the cholesterol level or increase the high blood pressure. So there are things like egg, maybe egg whites, cereals, vegetables, fruit, depends if the patient is diabetic. So you know the fruits to isolate. So in the area of feeding, the dietitian has to come in and advice is given based on other medical conditions involved.
Okay, that
Then
is it.
another thing, another thing I want to add is most people, they like taking alcohol, smoking, all those things. A stroke patient has to be advised. If they're allergic to, they're addicted to such things, they have to be weaned off it. Because a stroke patient cannot recover and go back to taking alcohols, go back to eating things that could make him get obese or being inactive. So all these things and lifestyle, lifestyle and genetics matters a lot.
Wow, ma'am. Okay, there is this, would I say, myth and fact and myth about stroke that once you recover, you're not supposed to be drinking water, or why you cannot drink water immediately after a stroke attack. How correct is that?
That you should not drink water immediately after stroke attack.
Yes.
After there's this these codings, we say fast, fast, FAST. When a stroke happens, you don't need to manage fast, FAST. Immediately stroke happens, you don't need to stay at home and start managing the patient. There are signs and symptoms of stroke. Immediately you notice stroke has taken place. What is the first thing you do? The first thing is to rush the patient to the hospital. Immediately you see that there is weakness of the face, weakness of the arm, the leg. You don't need to start giving water at home. Take the patient to the hospital, because most of them, they come down with problem with their swallowing.
Ma'am, so
Because
before you move forward, I want you now to once again, just as we wrap up the show, tell us, outline the signs of stroke, right? How do you know, or
okay,
how will the patient know that this symptom is for stroke or for something else? What is the difference?
okay. When a patient, not a patient now, when somebody notices that there is this incessant headache that you cannot explain, you need to find out, check yourself. And stroke, most of the times, will not give you sign. Okay, I am coming. Oh, the leg is getting weak. The hand is no, 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 no. Most of the times, it's a sudden attack.
Okay.
The person just sees that I can't move my leg, I can't move my hand. But before then, maybe the person knows he has high blood pressure and he's not adherent to his drugs.
Okay.
Maybe the person knows that I've been having this kind of headache, and each time my BP is always high. Oh, I went for test. They said I have high cholesterol, and you're not doing anything about it. So now, when you discover that my face has gone one side, is a sign. But that doesn't mean that every facial palsy is related to stroke. No.
All
But
right.
sometimes, yes, sometimes it could be a sign. And you discover that the hands dropped. This is a sign. The legs, sometimes it could be the one we call tear, transit ischemic attack.
Okay.
It can happen, within 1 hour. You get yourself back. You have to quickly go to the hospital, because the next time it might be devastating. So these things I mentioned now, you notice it, having a headache, having blood vision, I can't see well, my hands, my leg, my face, quickly rush to the hospital. Don't even wait to force yourself water at home. Because most of the times when stroke happens, the patient will lose ability to swallow. We call it gag reflex. So that's why, when you take the person to hospital, they put infusion for the person, because they start feeding the person through the drip. They make provision how to feed that patient, because they know that at that moment, the patient cannot
eat very well or feed very well.
Cannot even swallow. And if you force the person to swallow at that moment, the patient can get choked and die. So now they will now tell you that you shouldn't have given water. You shouldn't have given water. The person cannot swallow the water, and the water has entered the wrong track, and the person dies, got choked up and dies. So all those things are misconceptions, because it's from the hospital they will know whether this patient can swallow or not. And if a patient cannot swallow, cannot eat at that moment, they have a way of, by cutting the swallowing aspect, and also feed the patient.
Wow. Thank you so very much, ma'am. This is so educating. But as a consultant for over 20 years now, managing stroke patients now, maybe on our next show you have to bring some of your patients here so we can talk to them. And
they will be glad to come. Yeah.
yes, and Nigerians will have the belief that if it's stroke, if it's not herbal, if it's not this, can you leave a word for them before you go off the show, ma'am?
Okay, for those that believe that stroke, if not herbal solution, cannot be handled, I am here to tell you that belief is a false one, because I've been in the hospital for years. I've worked in the hospital. I've been managing stroke patients. I can confidently tell you that, please, when you have a stroke patient around, the best thing you can do for that person, rush the person to the hospital, because I've seen a lot of patients that were managed at home. They couldn't swallow. They left them there in the house and they died. Some of them with high blood pressure still going on, the arteries have ruptured, and they're still giving medications that also, raise the BP, and the patient died. So please, it's my advice to let you know that stroke is not a demon inflicted sickness. A sickness can be demonized, fine, but stroke is one sickness that is brain disease and is well managed in the hospitals. And for your rehabilitation, not just massage. Don't say I have a masseur at home that will massage the legs and limbs. No, the physiotherapist is trained on how to use a programmed and programmed set of movements that the brain recognizes. We feed back those information back to the brain, and immediately the information passes through the synaptic junction of the brain. The brain picks the information about this place is coming, and as soon as the brain picks it up, recovering sets in, and you see your patient walking again. So that's my advice to you. Thank you very much.
Well, thank you so very much, Mrs. Roseline Ibe, a consultant physiotherapist for over 20 years now. Thank you so very much for being on the show today. I
Thank
personally
you.
appreciate your time and all what you do for the patient. It's not easy, like you said, dealing with their emotions, carrying them along during the whole treatment process, knowing fully well that at that point they are not with you there talking about, you have to reprogram your senses and all that. So thank you so much. We appreciate you. And I'll have you again on the show, maybe with some of your patients next time.
Thank you.
Thank you so
Thank
much.
you. Thank you for having me. Thank you.
You're welcome. Yes, viewers, here on our health, your health will always come first. Your health matters to me personally because I'm of the belief or the opinion that health is wealth. Now you may have all the monies in the world, all the mansions, all the cars, but if you are not well, these things becomes burden to you, becomes a problem to you. And that is why you need to stay healthy. So when you notice any of the symptoms she did talk about, do well, please. That self-medicating, that I too know of Africa, herbs here and there. We're not saying herbs are bad, but please see your doctor at least to confirm this is A and this is B. Don't assume as well, because stroke is a killer disease. It is not something that you want to joke with. So the moment you have these symptoms, the moment you see these things, call your doctor or see your doctor. Well, while you're out there, drink water. Water is actually good for your health. And remember to stay healthy. Eat right, eat the right things. Do away with the things with cholesterol, those enjoyment, fried egg up and down and everything. Please know, especially the elderly, know that your health at this stage of life, you have to guard whatever that goes in. And I leave you with this saying that your body is the only place you have to live in this world. You may have all the cars, you may have all the mansions, but your body is the only place you're living in. And because if your body is not there, you are no longer living. So please do take care of your body. I'm going to see you again on the show next time. Like she said, she's going to come with some of our patients. And so you can get to meet them and understand what we actually talked about today. I'll see you again on the show next time. Remember to follow us on our social media handles. Follow us on Instagram, Facebook, Twitter, and X. Follow us on YouTube. Subscribe, invite somebody to the page, and leave us with your comment. We'll love to hear from you again. And of course, subscribe to our SRTV packages. We have travel tours anywhere you are in the world. We'll book your ticket for you, travel with us, and of course, we cover your event, any kind of event. Just call us. We'll be there. Our renters as well. We rent. We have all equipment for hire. So just call us, and of course, we have our production outlets. Amazing. Just working with your crew, and you start shooting. How amazing is that? And our magazine. You can showcase your brand, your products, your goods and services for as low as 30K. That is so amazing. So call us and we'll be there for you. please do well. Like I said, take care of your body. Take care of your body is the only place you have to live in. I'll see you again on the show next time. And I remain yours truly, Princess Kessy. Bye for now.
Hooray! The next President Show is here again. Are you aged between 18 and 30, smart, bold, and possess exceptional leadership skills? Do you have what it takes to be the next youth governor and future youth president? Then register free now at superiorradioandtelevision.com or call the number on the screen. The Next President reality TV show, moving politics out of the polite drawing room into the clamor of the streets.